See? Grace? Let's go.
Coming. Will I do?
Knockout.
Got your glasses?
Yes.
Spray.
All present and correct.
Rose Williams, I need to see Dr. Haskey. It's an emergency.
What's the problem?
Advanced bowel cancer.
Has it been diagnosed?
Oh, I have all the symptoms. Diarrhoea, weight loss, tiredness. Dr. Haskey gave this to me, so he must suspect. But please, I didn't sleep a wink last night.
Take a seat. I'll be 2 ticks. Hey, I've got Rose Williams in reception.
I saw her yesterday. There's nothing wrong with her.
Well, then why did you give her a bowel cancer leaflet?
I didn't.
Hey, you've got to talk to her. She's frantic.
Problem?
Congratulations. Your bowel movement has another recruit. Our geriatric hypochondriac is back with the illness du jour.
She's describing all the symptoms.
She hasn't got bowel cancer.
How can you be so sure?
Because she's got ATS, for which sadly there is no cure.
What's ATS?
Acute thespian syndrome. She's making it up.
You don't know that. What if you're wrong?
I'm never wrong.
Yeah, well, tell that to the BMA when you're facing a negligence claim.
Are you refusing to see a patient, Dr. Haskey?
Oh, grief, there's mutiny in the ranks. All right, Nurse Marquez. I'll get a sample. I'll even follow it up. And then later on, when nothing comes from it, I'll be accepting your apologies.
And this is my lab technician, Ruby. Ruby, my daughter Grace.
Hi.
It's lovely to meet you. So you're going to be spending the day with us then?
Will I be able to do stuff?
You can help me set up the lab for your dad's first session if you like.
Cool.
Come on, let's get you kitted out. Some of the stuff in here is pretty nasty, but as long as we stick to the safety procedures, no one gets hurt. I hear you plan to study chemistry at A-level.
Chemistry, biology and maths.
Oh, that's impressive.
So how did you get into this?
Well, to be honest, I wasn't really sure what I wanted to do when I finished my degree. So I went travelling for a bit, worked as a holiday rep for a while.
That's pretty cool.
Yeah, it was fun, but I wanted a proper home and a regular job. I've always loved science, so when this came up... Right, should we make a start? Want to take these things through for me?
Oh, we'll make a scientist of you yet.
Too much washing up.
We've got a special dishwasher for that.
We're out of disposable gloves. I must have forgotten to reorder them.
Won't the other labs have some? I can go check.
Oh, thanks, Grace. Ask Dr. Thomas next door, would you?
Back in a sec.
I underlined my symptoms. I have all of those.
Yeah, I wouldn't be overly concerned. They're common to many far less serious ailments.
But you've got to assume the worst, haven't you? My window cleaner's mother had bowel cancer and she died all because she ignored the warning signs.
Yeah, it's wise to get checked out, but in all likelihood, you've got nothing to worry about.
Well, you say not to worry, but I can't sleep. I couldn't face breakfast this morning. I don't know how I'm going to get through the day.
You brought a sample.
Well, it says you'd need one. Will it take long for the results?
This afternoon, if we're lucky.
Oh, that's good. Get things moving right away.
And you will find both of these products in your kitchen cupboard, by the way. What do you think, Ruby? So, the gas is carbon dioxide. What are the other products? Yes.
Take a child to work day? Well, I'm not familiar with that practice.
It's a chance for children to find out what their parents get up to all week, or in my case, parent.
Yes. It is a terrible thing to lose a parent so young. Oh, how are you, Grace?
Like Dad says, you've got to get on with it.
And now, do you intend to be a science lecturer like your father?
I'm going to be a doctor like Mum.
Well, she will be very proud of you.
I know, so it really would be useful if I spent the day here. Not that Dad will let me. I bet there's a lot more to your job than meets the eye, Miss Tenby.
Oh, yes. Yes, that is true. For this position, you need a very varied skill set, as well as greeting patients. I have to consider health and safety, doctor's hours.
Computer systems?
Indeed, as we are all computerized at the campus. I can access patient files at the click of a button.
And are you linked to the university too?
Oh, yes. The university intranet, see? Where I can communicate with anyone from the university via email. Oh, now, Grace, this is Dr. Reed.
Hello.
Grace's mother was Dr. Abbott.
Yes, I remember.
Grace also intends to be a doctor. Well, perhaps you could show her around, Dr. Reed.
Oh, that would be wonderful, but I can see you're busy. And I really should get back to my dad's lecture. But can I come back later? Thank you so much, Miss Tenby.
Oh, such wonderful manners.
Ta-da!
Dad, what about your cholesterol? Saturated fat
Is the enemy, yes, I know. One cream bun won't hurt.
You always say that.
It's a special occasion.
It's 500 calories of artery clogging menace.
Yum, yum. That's for Ruby.
So, Grace, what do you think of degree-level chemistry then?
Child's play.
Cheek.
Face it, Dad, you get to fool around with a bunch of kick-ass toys and you get paid.
Which toy do you like the best?
The mass spectrometer's cool, but what I really love is watching my dad do his thing.
Really? That's very sweet of you, Gracie.
You're such a pushover.
See, Ruby, my daughter has me wrapped around her little finger.
Well, that's what you like me to think.
It's true.
We'll see about that when I try and make you eat carrots for tea tonight.
Carrots.
Well, something healthy anyway, to make up for that fat fest. You've got a lot of friends.
You don't think she's noticed anything, do you?
Would it be so bad if she did?
It's too soon. Anyway, there's no rush, is there? You're suddenly very popular.
On the text, some marketing robots got hold of my number. Now, about the hands-on stuff you're so good at.
Dad? Ow! Dad!
I'm fine.
Don't lie, where's your spray? What happened? I'm taking you to see a doctor.
I banged my elbow, that's all.
Dad, you're breathing funny.
Yeah, you are.
Feeling better already. See?
Dad, please see a doctor. You can't take the risks.
Perhaps you should, just to be sure.
Okay, but I'm absolutely fine. Why don't you get my next session set up?
Hello again. I wondered whether my results were back.
They've only just gone to the lab. Didn't Dr. Heskey explain?
He did say this afternoon, but I'm so worried. Every second counts with this kind of cancer, doesn't it?
Oh, I'm sure you're worried, but why don't you go and have some lunch?
Can't possibly eat. Not with this hanging over me. Oh, Dr. Heskey, I wondered whether my results were back.
I told you I'd call when they came back.
Yes, but I'd been out. Perhaps I should wait?
It's up to you, but it might be a long one.
Oh, I don't mind. I'd rather be here, you know, in case anything happens.
I'm fine, honestly. It was just a twinge.
And the pain dissipated as soon as you started taking your medication?
Yes, I really didn't want to bother you, but Grace gets so anxious.
Oh, that's all fine. Any other symptoms?
None, no, I'm in top form. Apart from the angina, obviously.
So, what do you think started it?
Rushing around.
What were you doing just before the attack?
I was moving stock, heavy boxes. Bang my elbow.
Well, next time get some help lifting heavy boxes.
Oh, seeing as I'm here, I am running a bit low on my GTN spray.
Oh, OK. Well, let me just check and see when you last had a prescription.
Hello? How dare you, you sicko!
You all right?
Oh, yeah, prank call. I'd better finish off in here.
Ruby, I just found this in with the solvents. That's such a basic error and potentially very dangerous.
I do know that, Gerald. That's why I always put it in the separate fume cupboard.
This isn't like you. Maybe you should go home.
No. I'd like to carry on. Please?
Okay.
Hi, Ruby.
Grace, when we were setting up earlier, you don't remember moving any chemicals, do you? It's just that two very dangerous chemicals got placed in the cupboard next to each other.
What, and you're accusing me?
No.
How dare you! You screwed up and now you're trying to shift the blame!
Grace?
She said it was my fault!
No, I didn't.
Daddy, she did! You do believe me?
Grace has injured her ankle.
Oh, you poor child. Please take a seat. Dr. Reed will not be long.
I'm so sorry about your viscometer. Will you be able to fix it?
It's not your fault.
I was just so upset.
Yeah, Ruby should never have accused you. She's not herself today.
Daddy, don't be mad, but maybe I did make a mistake. I just didn't like to disturb her.
Well, that's her job. She should have been supervising you.
She was busy texting.
Texting?
Her boyfriend, I think. She was laughing a lot. I haven't got her into trouble, have I?
You're not to worry about Ruby.
Dad, you should go back. You've got a 12:30 seminar.
No, I'm not leaving you here by yourself.
I'll be fine with Mrs. Tenby, honestly.
You've still got full movement. No sign of any ligament damage.
So, it's not broken or anything?
No. Stand up for me. Put your weight on it.
It hardly hurts at all now. Dad was in such a panic. Maybe it rubbed off. That's a relief. Thanks. Bye, Mrs. Tenby.
Goodbye. Oh, you are a miracle worker, Dr. Reed.
You've got quite a soft spot for her, haven't you?
She has had a lot to deal with. We're losing her mother. And she's so good with her father, always helping.
I didn't accuse Grace of anything, and my mobile was off while we were setting up, so no, I haven't been texting some fictional boyfriend.
Well, you can't deny someone's been texting you.
Like I said, it's spam.
Show me.
You want to see my messages? No, you should trust me.
I trusted you to supervise my daughter, and look what happened. Grace.
Torn ligaments. Don't fuss, Dad. I'll be good as new in a few weeks. I don't know about you, but I'm starving.
Well, let's get you something to eat. Why didn't they give you crutches? I've got a walking stick somewhere. Come on, Gracie.
Hello? Stop calling this number or I'll report you to the police.
Sorry to interrupt. I'm Dr. Reed from campus surgery. I was looking for Grace Abbott.
Ruby Winters. She's gone to lunch.
You don't know when she'll be back. Sorry, do you need to take that? Are you all right?
I'm sorry, I'm just having a really bad day.
Nuisance call.
Could say that.
Dr. Reed.
Oh, hello. I just thought I'd pop in and see how Grace was doing.
Well, thanks for patching her up.
Oh, no problem. Bandage not too tight, Grace.
Fine.
Why don't I have a quick look?
Well, I'll leave you to that. Ruby, I'd like to reorganise the afternoon session.
Sorry, did I miss something?
Don't worry, I'm not going to sue you.
Grace, what's this about?
It's none of your business.
Well, your health is my business.
Rosie's results.
Blood in the stool.
It's an indicator.
It's an indicator, not a diagnosis. Blood in the stool can be down to any number of things, most of which aren't serious. See? You've been getting your knickers in a twist over bleeding hemorrhoids.
No, the point is, you don't know what's causing it. And there's obviously something wrong. And you were so quick to just write off her concerns.
You need to put the... What the hell is that? What are you doing with my photo?
Like you don't know? I thought I was the only man in your life. I'm surprised you can fit me in with all the hot hunks you've been playing with.
I've never seen this before.
Oh, so what's your photo doing on there? Not to mention your mobile phone number. If you wanted to call it a day, why didn't you just text me?
You really think I'd do something like this?
Well, now we know why your phone's been ringing all day.
If you really think I'm capable of something like this, then maybe I've misjudged you too. I thought this was different. Special.
Daddy! Oh, get help!
Mrs. Williams, if I was a bit short with you earlier, I want to apologise.
You've found something. I've got bowel cancer, haven't I?
No, it's too early to say anything for sure, but I would like to send you for some more tests.
In the hospital?
As an outpatient, I'll get the process underway immediately.
So, what test will I have?
Well, that'll be up to the specialist, but will most likely involve examining your bowel and rectum using a telescopic camera or a barium X-ray.
What about an MRI scan? Will I have one of those?
You really should get checked out at St Phil's.
Honestly, I'm fine.
Daddy, you should go. Your spray didn't work.
That's because it's empty. Anyway, it was more of a panic attack. I was upset.
Well, if you won't go to the hospital, then you must come and see me tomorrow. And we'll get that prescription filled. Grace, will you walk me out?
He will be all right. You said he should go to hospital. Can't you make him?
No, I can't. But he seems fine at the moment.
So, what did you want?
Oh, your ankle seems better.
Oh, yeah, it stopped hurting. Is this about my ankle?
Oh, so you think that's why I'm here?
Rose, you know there's every chance this is nothing serious.
Oh, that's very sweet of you, dear, but you don't need to sugarcoat it.
I'm not. I just don't want you worrying unnecessarily.
What will be, will be. I just have to be strong.
Do you fancy a cuppa?
I had a call from the university IT department.
So?
Apparently, somebody logged on to the university intranet using the surgery's account and then sent an email to everybody in the university address book.
What's that got to do with me?
In the email, there was a link to a dating website, to a page in the name of Ruby Winters.
Maybe you should be talking to Ruby then.
Well, Ruby didn't send that email. You did. You were standing behind Mrs. Tenby this morning when she logged on.
So what if I did?
Grace. How long have you known about your father and Ruby?
Since I found her photo on his mobile. He's been extra happy for a while, so I guess there was someone.
I know it's hard, losing your mum. But your dad is entitled to a relationship.
You don't understand. She's going to kill him.
Dr. Haskey's referring me for tests.
He has explained to you what that might involve.
Oh, yes. I'd better let David and Brenda know. I expect they'll fly over from Australia. Oh, it'll be lovely to see the girls.
Bowel cancer isn't an opportunity to catch up with the family. It's a serious disease.
I know. And I'll be seeing a specialist and everything.
You could be facing some really unpleasant procedures, months of treatment.
Well, at least it gets me out of the house. And people are so kind when they learn you're ill. I was only telling my neighbour this morning and she promised to run me back and forth to the hospital.
But you've only just had the results.
I knew when they found the blood that it would mean more tests.
Rose, did you put the blood in there?
Just a few drops. I wanted to make sure they investigated me properly. Don't worry, I'm not scared. I like to think of it as an adventure.
Bowel cancer is a serious condition and people do need to get checked, but lying like this...
I didn't think I was doing any harm.
Have you ever done anything like this before?
Not exactly.
I need you to be honest with me now. It's important.
Well, I might have made a bit of a fuss here and there, but you have to, don't you? Or people don't take any notice. What if I had a malignant tumour? And my tummy has been really upset. It could be bowel cancer.
I would really like you to explain this to one of my colleagues. Would that be okay?
Am I in trouble?
No, you're not in trouble. We just need to make sure we're doing the right thing for you.
Your spray.
Thanks. Why don't you...
Gerald.
You might as well knock off early.
Actually, would you mind sticking around? Grace has something she would like to say.
I put Ruby's details on the website, and I emailed the link to everyone in the college. That's why she's been getting texts and calls from weirdos all day.
Grace?
Let her finish.
And Ruby didn't mess up this morning. I put the chemicals in the wrong place on purpose, and I stole the photo of Ruby from your phone and put it on the website. And there's nothing wrong with my ankle.
But why?
To break you two up.
What do you mean?
Gerald.
Oh, I'm sorry. I didn't want you to find out this way. Why didn't you say something?
Mum's dead. I can't cope with losing you as well.
Gracie, I will always be your father. Ruby would never interfere with us.
That's not what she means.
Dad, you've got health problems. She's a lot younger than you. Last Saturday when I called, you sounded terrible. I knew you were with her. You had an attack, didn't you?
Why didn't you tell me?
You were in the bath. It was nothing.
Gerald, if our relationship's affecting your health, then I need to know.
Actually, physical activity is good for angina sufferers. It keeps the blood circulation going to the heart. Gerald, if you're worried about sex bringing on an attack, you could use your GTN spray beforehand. We'll talk about it tomorrow.
Yeah, well, thanks. Yes.
Please accept my apologies, both of you.
Ruby, I'm so sorry. Grace has behaved abominably. As your manager, if you want to take this any further, I can set things in motion with HR.
Gerald, shut up.
I'm sorry it's short notice.
No, you did the right thing. I'll have a chat with Rose. Could you give Bernie mental health a call?
Yeah, of course.
But you think it's Munchausen's?
Well, that's down to you. But, thank you, Jimmy. Rose, Dr. Clay is going to take care of you now. Is that okay?
Hello, Rose?
She admitted to everything, from setting up the website to faking her injury.
I would never have believed it possible.
Appearances can be deceptive.
Still, I should have realized she was up to something.
Don't take it to heart. She was very convincing. Her intentions were good, even if her methods were questionable.
But you were not fooled.
Takes one to know one. Anyway, she'll be in later.
She will?
She wants to apologise in person. Grace is no angel, Mrs. Tenby, but you were right about one thing. She has excellent manners.
I've been speaking with Rose.
Yeah, and you've come to gloat. Thanks very much. Close the door on the way out.
Just so you know, it doesn't look like she's got bowel cancer.
What?
She added the blood herself so you'd send her for more tests.
She told you that? I knew she was a time waster.
No, she was willing to undergo all kinds of medical interventions just so someone would take notice of her.
Munchausen's.
She's with Jimmy, he's referring her.
You referred my patient to another doctor?
Well, you should have been more interested in your patient.
All right, so it's my fault.
Well, yeah. You palmed her off with a load of leaflets when what she really needed was your support.
Yeah, you just can't admit that I was right.
You were not right. You missed what was potentially a very serious mental health issue.
Yeah, when you've quite finished with the frenzied posturing, Nurse Marquez. Do you think you could squeeze in that apology you owe me?
You're forgetting. This was my crew until you swiped my job.
Is she coming?
He had a face on like he was sucking on a lemon.
Because I was sucking on a lemon.
All right, Dennis.
Ow.
How's Masha?
What did you say to driver?
Nothing much.
Sorry, you've got the wrong number. Goodbye.
So Matt Wheatley would like that truck driver to ride stark naked on a little girl's tricycle.
Cat's finding it